hope you're having a great day. Today I want to talk about bone health. Bone health is so important. Today we have people in their early 20s, 30s getting osteoporosis, osteopenia, having bone loss. And this isn't a good thing because we need to understand that your bones have a lot of function. It's not just support of your structure. Within our bones, we have bone marrow. We produce stem cells. Stem cells is the fundamental of your immune system. So we need stem cells to repair us, to prevent disease, fix us when we have cancers, when we have burns. Your bones play a huge role in your health. And the point is, today we have bone density problems, lack of density because of lifestyle, poor lifestyle. Of course, there are certain surgeries, there are certain medications, certain chemotherapies, certain hormonal treatments that can lead to osteopenia or osteoporosis. But the point is, there is always lifestyle that can help us prevent this. What we're going to understand today is go a little bit deeper into bones. I want you to understand this new word. It's existed for a long time, but we don't talk much about it. It's a nice way to inspire ourselves to work out, to move from sedentary to active. Osteoblasts. Osteoblasts are produced by your bones. They help you to form your bones. Osteoblasts create more bone for you. And you have another class which is called osteoclast that breaks down bones. So for example, if I'm eating a poor diet that doesn't have enough of calcium, or I'm taking medication that depletes calcium or D3, or I have certain parathyroid issues, my PTH levels are all over the place, they're not in the normal range. What happens is my body has to break down bone to release calcium into my blood. So osteoclasts break down bones. Osteoblasts form bones. Now, how do we get osteoblasts to be produced? And again, it comes down to the power of lifestyle. The more osteoblasts I can produce, the more bone density I have. So even for a patient who has osteopenia, who has osteoporosis, weak bones, low bone density, yes, you don't have to put more calcium into your body. Let me give you an example. The country India and the United States of America, they are the highest consumers of dairy products and calcium supplements. And India and the United States of America have the highest amount of cases of osteoporosis. More calcium and more dairy doesn't mean better bone quality. Today it's way over calcium. Calcium was pushed by the supplement industry and people started overdoing it on calcium. If you have too much of calcium, you can have blockages in your arteries. You can have kidney stones. You can have numerous problems with different organs in the human body. When you look at a bone, yes, you need calcium. You need vitamin D3 because vitamin D3 improves the absorption of calcium into your bones. But you also need magnesium and you also need vitamin K, K2. This is what forms the bone matrix. So we need to understand that it's not just about calcium. Number one, people are taking more and more calcium, but 1 in 2 people, if not every person, has low vitamin D3 levels. So now you have calcium that's not even getting absorbed into your body, into your bones, because you have a lack of vitamin D3. And that is why it is more important for you to have better vitamin D3 levels, so that the calcium that you have or the calcium that you're eating from the foods that you ingest can get absorbed the right way with vitamin D3. So I need vitamin D3, I need calcium, a good quality calcium, preferably from food, and of course supplementation as you age or if you have any medical issue or your doctors ask you to be on that. There are different qualities of calcium. There's cheap calcium that doesn't get absorbed. And then there is calcium which is quality and gets absorbed way better. I need magnesium from the foods that I eat or supplementation, and I need vitamin K2 from the foods that I eat or supplementation again. So a really good calcium supplement that you buy will have all of them. Calcium, D3, magnesium, and K2. Otherwise, you're eating a great diet and you're getting it from your food. So now what else can improve osteoblasts? Because we want osteoblasts so that we have stronger bones. Okay? Weight training. Weight training is the best way. Plyometrics. What is plyometrics? Plyometrics is a form of exercise that includes jumping. So it could be as simple as jumping jacks, to skipping, to imaginary skipping, to jump squats. I can make it more intensive, or I can do box jumps. It's up to you. But every time I create a jumping action, It is putting a certain stress on your bones. The stress on your bones is what produces osteoblasts, which in turn makes your bones stronger. So we need to understand, now any kind of exercise is good for osteoblasts, whether it's walking, whether it's resistance bands. The idea is, how do you put tension or pressure on your bones? So in the olden days, even in places like Japan or China and different parts of the Far East, you had this wooden piece and people would keep banging their hands, like not really hard. So you're shocking yourself, you're banging your bone on a piece of wood gently, but that makes your bones stronger. So if you have a punching bag at home or in your gym, the mere action of punching or even just knocking the bag with your arms or even kicking the punching bag produces tension on your bones, which can help you with osteoblasts. So exercise number one, eating more vegetables. Your diet has to move from ultra-processed food and junk food to more of what nature's given you. So your green leafy vegetables, your colored vegetables, all of that is great for you. If you have a calcium deficiency, fix it with a supplement or the right foods under the right supervision. What is also important for you is maintaining a healthy weight. This is so important for you. Now let me give you the bad side of people who are doing fat diets and under 1200 calorie diets or under 1000 calorie diets to lose weight. Low calorie diets causes the loss of bone density. So you may finally starve yourself to fit into that dress or that pair of pants or that t-shirt, but you have weaker bones. And that's why you have a lot of people in their 20s, 30s, 40s, 50s, 60s on fat diets to lose weight in a quick fix manner. They go on low calorie diets for extended times. Low calorie diets equals bone loss, bone density loss, which is absolutely dangerous for you, for your immune system, for injury, for structural support. Today you have people who break their bones and take months and months to recover because they have poor bone quality. Then protein. If you're protein deficient, it's a problem. The reason we have muscle is to protect your bones. The more muscle you have, the stronger your bones are. If I have less muscle, my bones are constantly taking the shock and the tension that your muscles are supposed to take. And that's what weakens your bones over time. And then you have your omega-3s, your fats, your good fats. Don't be scared of fat. Bad fat makes you fat. Carbohydrates in excess makes you fat. Sugar makes you fat. Inactivity makes you fat. Sleep deprivation makes you fat. Hormonal imbalance makes you fat. Chronic emotional stress makes you fat. Good quality fat does not make you fat. Good quality fat leads to better hormonal balance. Good quality fat, in fact, boosts your metabolic rate, which helps you burn bad fat from your body. So your omega-3s, your good quality fats, is important for osteoblasts and for your overall bones. So you see, it's a lot more than just calcium. If you want to improve your bone health today and you want to have strong bones when you're 40, 50, 60, 70, it starts today. Now let me share another piece of information that should inspire us to move from inactivity or from a sedentary lifestyle to being active. Inactivity increases osteoclasts that breaks down bones. So the more sedentary you are, the weaker bones you have. The more sedentary you are, the less muscle you have. The less muscle you have, the weaker your bones are. So when it comes to your bones, it's a bone matrix. It's calcium, vitamin D3, vitamin K2, and magnesium. It is exercise. It is putting tension on your bones. So even a simple, let's not call it exercise, but a movement like dancing or jumping or swinging. You have a pull-up bar. Maybe you can't do a pull-up, but just hang on the bar. That puts so much of tension on your bones, making your bones stronger. You can't do squats. You can't do jump squats. Any kind of exercise that puts stress on your bones the right way and your muscles is good for your bone health. Have a great day, everyone. Today, let me go back to one more point. Today, people have money and they misuse that money. It's okay to be wealthy, but be wealthy with the right attitude. There are people who say, oh, look, it's okay. I'll just get a knee replacement. I'll get a hip replacement. You know, it's okay. I'll get another knee replacement. They don't want to take care of their health. You got to understand that knee replacements aren't like just dishing out candy. A lot of people still suffer post a knee replacement or a hip replacement. So if you genuinely need it, do it. But if you have to do it because you have a poor lifestyle, let me tell you, The life of your new knee or your hip also has a life. A lot of people's bodies reject the foreign object, the knee or the hip that's being put into their bodies, the screws which are being used. They have autoimmune conditions. They have other complications. So while you have a lot of money, also have the right attitude. There are no shortcuts. There are no quick fixes. Yes, you have an accident. You really have an issue. Take advantage of these surgeries. But if you're using it because of a quick fix, please understand today, at least in India and a lot of countries that we deal with patients, the slightest knee problem and the patient is sold a whole plan of knee surgeries that they can do without any advice given on changing your lifestyle. So let's say you get the knee surgery done, but you haven't changed your lifestyle. You still have the root cause of the problem. You're still going to have problems. Your new knees aren't going to solve the problem of you solving it at a root cause level. So always address the root cause and do the right things. The best things in life require patience. The best things in life are actually free if you are willing to be patient and put in the work. Have a great day, everyone. Until next time, eat smart, move more, sleep right, breathe deep, and remember, you care is all about you.